Hi, Dr. Shook here. It is Thursday, August 21st of 2015, and today I want to talk about your TSH levels, and that's the hormone that is most commonly looked at with hypothyroidism or thyroid dysfunction. Most doctors use it as the one laboratory marker to help them make a determination on how much thyroid hormone replacement you need. So I want to talk about this because this is a really big concern of a lot of my patients, and I'm going to tell you about some new research that was published rather recently. The optimal TSH level is, in my opinion, and in the opinion of a lot of other people, is somewhere between 1.5 and 2.0, or maybe even a little bit lower, somewhere in the 1 to 2.0, but not above 2.5 range for TSH, which is a pituitary gland hormone that tells your thyroid to ramp up production of the thyroid hormone itself. Before I really get into this, I want to state one thing that you really need to know. TSH overall is an inadequate marker to determine how your thyroid is doing. Okay, I'm just going to tell you that. So we're talking really you need at minimum 5 to 6 markers, including total T4, total T3, free T4, free T3, T3 uptake. We need to look at reverse T3 and TSH. And if you haven't had it done, you need thyroid peroxidase antibodies and thyroglobulin antibodies to see if you have an autoimmune process against your thyroid. So just, if we're only talking about TSH, which is what most people are prescribed, and if at some point you've had all those tests I just mentioned, then maybe, perhaps, that would be, somewhat reasonable. But I like to get many more markers so that I can actually see what's happening with the thyroid, because there are numerous patients that come in with TSH levels that are, you would say, normal. They're within the lab range, and they have all kinds of problems with the actual hormone levels or their body's ability to be able to use or uptake the hormone. So there was some research that was published, and they said that people that had TSH above 2.0, okay, so really, most of the labs, the interesting thing is, I've got to tell you this a little bit of background. Most labs, they have different ranges for what is normal for TSH depending on where you are in the country, because those ranges are typically based off of an average of people that go to that lab. Now, it's a whole different topic, but I know most people don't realize that their lab ranges are actually just dependent upon the people that go to that lab and the averages of what their numbers come out to be. Okay, so first of all, TSH, in my area is somewhere between 0.5 to 4.5 is considered the normal lab range. There's a clinical study that was published, and there are numerous other statements in the literature out there, and endocrine societies and things that publish what they think is optimal for TSH. But 2.0 looks to be where you want to be. You don't want to be above that, and you don't want to be very, very far below that, because then you can be hyper or you can have other problems. But 2.0, you don't want to be above 2.0. Now, this research study that was published, they said that if you're above 2.0, you're more likely to be insulin resistant and to have metabolic syndrome and be, obese and gain weight. So that's a very important marker. Now, if you've had all the other tests that I mentioned done and you're on a replacement, then that might be reasonable. But I would just encourage you to routinely have your doctor check those other markers. And if they won't check them, then find someone that will, because in my opinion, just looking at TSH is outdated for the majority of patients' needs, and they're going to tell you, well, it's not medically necessary for me to check the rest of these markers. Well, I'm going to tell you right now, I check a ton of markers every single day on a lot of patients, and we find all kinds of problems that are contributing to poor health, and they're considered not medically necessary by the insurance companies. So, I decided a long time ago that I was going to do what the patients need and not what is considered medically necessary. I'm going to do what needs to be done regardless of what the insurance company considers to be medically necessary. And, you've got to understand there are a lot of factors that come into your doctor practicing the way they do. If they're owned by a hospital system, they will get penalized if they order tests that are not medically necessary and they come back and the hospital has to reimburse money because the documentation cannot support ordering some of these other markers. You have to understand, insurance companies are not there to survey and look for problems that you don't have any evidence on exam or history that really exist, right? Because they're trying to contain costs. And I'm not saying that system is bad, but I'm just telling you we find all kinds of problems every day that are not considered medically necessary. So I do what people need, not what the insurance companies say is medically necessary, because I don't really care. I'm going to do what I think's best. So TSH 2.0 looks to be optimal. When it's higher, it tends to indicate that it can indicate if these hormone signaling systems are working properly, that your thyroid hormone levels are low and you don't have enough thyroid hormone. Now that's how it's supposed to work. It's not always how it works, but that's how it's supposed to work. So if you're at 2.0 or below, or not too low, then that is a better factor or better indicator that you're going to have more optimal metabolism, and you're not going to have the insulin resistance. You're not going to have high fasting triglycerides. So I wanted to share this with you because I think it's an important point that you need to realize, is that TSH is an important marker. I think it's inadequate, but if everything has been measured in the past, you don't have an autoimmune thyroid condition, you're not on a replacement, 2.0 looks to be optimal. Above 2.0 is associated with obesity and metabolic syndrome and other issues. So I'm Dr. Shook. I hope you found this useful. And this is our 5th sauna session. And I'm going to keep teaching about things that are relevant and I think that will help you. So if you have any questions, just let us know. But hope you have a wonderful day. Thanks.
Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great